Well, good morning, everybody. Thank you for joining us for our third Business Insights of the year. This is a series that we're doing here in the business school where we pair a faculty member who's doing research on important topics with people in industry who are on the bleeding edge of implementing those areas of thought. My name is Scott Dawson. I'm the dean here in the business school. Before we get started, I just want to acknowledge here in this chilly morning in Denver that we sit close to the confluence of Cherry Creek and the Platte and honor the peoples whose lands we inhabit, the Arapaho, the Cheyenne, and the Ute. We have a nice group of folks online with us today, folks from industry, alumni, as well as students. We have a wonderful panel. It's going to be moderated by my good friend Rulon Stacy, who's the executive director of our health administration programs, which includes top 10 EMBA in health administration, MBA in health administration, as well as a vibrant health administration research consortium, which is also led by one of our panelists today. So at this point, I'll turn it over to you, Rulon. And just one thing, if you have questions, please do put them in the Q&A, and then we will get to those towards the end. Rulon?
Okay, thank you very much, Scott, and welcome everybody to our webinar this morning. We're very excited to have you here on a topic that is top of mind for all of us in healthcare. Over the past couple of years, we have all been witness to one of the most dramatic transformations in healthcare and that any of us will ever see, and certainly has ever happened in my career. And it was driven by a pandemic, and it forced us to find a new way to do business. And this disruption is allowing us to learn things that we would otherwise not have learned. And to discuss this today, this digital disruption and the impact that it's having on health systems, we have invited three distinguished panelists. And here we've got the bios of them, although I'm going to give each of them a chance to tell a little bit about them and their background. I do want to give a shout out to one of our alumni, Vu Van, who knows everybody and has been able to persuade Tanya and Vikas to join us today. Jabon is here because he has to be here. He is an indentured servant. We make him come to these kind of things. Tanya is the Vice President of Strategy and Innovation at Transcarent, and will tell you a little bit about Transcarent and their role in this digital disruption. Vikas serves as a Senior Director of New Market Development at Hinge Health. We'll also ask Vikas to give us a little bit of a background on Hinge and why Hinge is important and what issues they're trying to address. Jabon is a full professor at the University of Colorado, Denver, and leads our health administration research consortium. I encourage all of you to go to the website of the Health Administration Research Consortium. Maybe Jabon can put the website address in the Q&A link, because he's so good at that. It is, I think, honestly, the most relevant research, academic research website for healthcare in the country. And there's just some great things going on. So with that, I am going to ask each of the panelists in the order that they're presented on this slide to take a few minutes, tell us a little bit about you, a little bit about your company, and your thoughts on digital disruptions on healthcare systems, what we're seeing, what your opinion on some of these issues might be. So, Tanya, the floor is yours.
Thank you. Good morning, everyone. It's good to be here. Just a little bit about myself. Again, I'm Tanya Dillard, Vice President of Strategy and Innovation for Transcarent. We just came out of stealth mode under a year ago, and you may have seen that on social media, particularly LinkedIn, as Glenn Tolman, our fearless CEO who came from Livongo, another digital tech startup. He is our CEO, and he seems to be all over social media. So just a little bit about me by way of background. I have been in healthcare my entire career and have sat on the delivery side. I started in public health and then went into a hospital system and then worked on the carrier side as well, working for two very large national payers, and then went into more of the boutique side and vendor side of total population health management. So I've seen this kind of evolution of leveraging digital technologies over the course of my career, and certainly much more recently with the onset of the pandemic. To give you a little bit of thought around Transcarent and what we do in our view on digital transformation is our aim is really to provide health and care kind of on the in terms of what the consumer wants, and really based on the consumer's terms. We believe that there are three elements that are really essential in doing this. And the first is unbiased information. We recognize that without unbiased information, you don't really have trust, and trust is necessary to actually help get people to the care that they need. If they don't recognize you as a source of trusted information, it's very difficult to then have a partnership in making sure that people get what they need from the healthcare system. So trusted guidance is the second foundational piece. And then access to high value care. We believe strongly in this, and in fact believe that one of the other disruptors that you'll see coming in healthcare is an increase in direct contracting. And so we do a lot of this. One of the initial businesses that Transcarent has acquired was Bridge Health. And Bridge Health, which is where I got pulled into Transcarent as part of that acquisition. Bridge Health is a surgical centers of excellence, and they are really on the forefront of direct contracting. So we think those three elements are foundational in a great health and care experience. And when we think about that in terms of how that intersects with digital technology, we really see digital therapeutics as a significant enabler to complement what we do in terms of in-person care. And so we believe that kind of the care of the future is this multi-setting care where there is this kind of complement of digital in-person that may actually be inpatient or in an office, but also at home. And we believe that that's going to continue to grow over time. And so we are very excited to work on the digital piece of this, and happy to kind of talk a little bit more about that as this session continues.
Tanya, thank you. Vikas.
Great. Well, good morning, everybody. Thank you for being here at this early hour. And thank you to University of Colorado Business School for hosting this webinar and inviting me as a panelist. My name is Vikas Salgia. I'm a senior director at Hinge Health. I've been in the industry for close to 2 decades. I'm now at a digital therapeutic or digital health company. Prior to that, I've been within the health system, and I've also consulted for health systems as part of a management consulting firm for several years. So have been in the industry for quite a while and seen it from multiple angles, both for payers, providers, and now digital health tech company. Maybe I could share a few slides, Michaela, and talk about Hinge Health. So Hinge Health, we pioneered digital musculoskeletal care, MSK. The company was founded in 2015 by a pair of co-founders who are both scientists, and they had personal sort of experience with musculoskeletal injuries. And they wanted to really redefine the space and not just make it about digital physical therapy. So over the years, through various product iterations and a lot of blood, sweat, and tears, we ultimately ended up with the current version of the product. And we're live in over 600 employer clients covering over 14 million lives. 4 out of 5 health plan sponsors and employers that choose to go with digital MSK choose partner with Hinge Health. A large portion of our member base is from self-insured clients, but we're certainly starting to roll out in fully insured and Medicare space as well. We're over 1,000 employees strong and growing. And half of our team is a full complement of clinical care team members. And I'll get into that in detail in a little bit. And we've received over $800 million in funding to date, which we continue to invest in a strategic manner for enhancement in the product on behalf of our members. Michael, if you'll advance the slide. So what is Hinge Health? Hinge Health, like I said, is an end-to-end digital MSK solution. Obviously, there is a big component of health tech involved, but a big reason why we've had the success we've had with our members, both from an outcome standpoint as well as from a experience standpoint, is that we've been able to sort of combine advanced digital technology with a full clinical care team complement to reduce MSK pain, depression and anxiety, reduce opioid use, and reduce surgeries. And that has had a significant impact on reduction in medical claims costs. Tanya, Michael, if you'll advance the slide, please. So our solution is founded on 3 key pillars. First one is a complete clinical care team, and these are clinicians that we employ. They're not contracted, and we all have aligned incentives that we deliver the best care. So we've got physical therapists, we've got board certified health coaches, we've got physicians and surgeons. And each one operates at the top of their license to provide members the highest level of care. We've got a comprehensive advanced technology that includes wearable sensors, computer vision, and Enso pain relief device. And I talked a little bit earlier about using our funding to make sort of product enhancements. I could give you guys a couple of examples. Last year, we acquired a computer vision company called Wrench. And the addition of movement tracking technologies enables Hinge Health's care team to deliver the most personalized whole body approach to physical therapy. So we're really excited about this acquisition because now we have technology that was previously only available to elite athletes and motion picture industry. We'll be able to make it available to our members. Another technology that we have is the Enso pain relief device, which is a groundbreaking, clinically validated, non-invasive, non-addictive, high-frequency pulse therapy for those members that are in intense pain. And this provides immediate and long-lasting pain relief. So this is particularly suited for those members that want to get off opioids and avoid elective surgeries. And the third leg of our product solution is connected care through Hinge Connect. And this is how we sort of seamlessly integrate between the digital world and the real world by connecting with over 750,000 in-person providers spread across 71,000 locations around the country in order to improve member outcomes with real-time interventions, care personalization, and coordination. So our solution combines these 3 pillars to engage members in their own care and wellness through direct prods, social nudges, and gamification. And what that does is it transforms members' behavior from one of that is passive participant in their care to one that is an active agent in their own wellness and care. And, Tanya, Michael, I'm sorry, I keep saying Tanya, I'm sorry about that. Michael, if you'll advance the slide. So what does all this mean in terms of outcomes? So we've have results that have, shown great member outcomes and cost savings and ROI. We've done, if you look at from a patient perspective, we've had 60% reduction in depression and anxiety, 2 out of 3 surgeries avoided, and about 70% pain reduction, which essentially leads to over 60% improvement in productivity. And if you look at the ROI and savings, we've achieved 2.2x to 3.5x ROI by reducing medical claim costs. And this is not just Hinge Health claiming. We've done large cohort studies, so over 10,000 participant studies. We've done longitudinal studies, so multi-year studies, and these have been validated by third parties as well as elite universities like Stanford, Vanderbilt, and UCSF. So we're really excited. As Tanya mentioned earlier, digital therapeutics is certainly a huge enabler, and we're really excited that we're able to bring that therapy for our members and deliver care that is effective, affordable, and convenient. And with that, Ron, I'll turn it back over to you.
Thanks very much. Did you say, by the way, 800 million in invest? Did I hear that right?
Yeah, 826 million.
Okay, well, that's going to be one of my first questions is there's clearly a lot of money out there for this, and what is the future? But Jabon, tell us a little bit about you and your thoughts on this.
Thank you, Roland. I'll divide my talk into three. First, I'll talk a little bit about HARC, one of the studies that we have done. Then I'll move on to some.
And HARC is
Health Administration Research Consortium. We started it as a consortium of 15-20 faculty who are interested to monitor and investigate into the challenges and issues, opportunities for health systems inside the United States, across the United States. We started asking questions, analyzing data, and providing several insights to health systems so that they can be better or develop better. When that happened during COVID-19, we did realize that one of the major things that we are talking about is innovative technologies, digital health. And we saw some of the health systems leapfrogging around this innovative digital health technologies. We saw several of them apply to COVID context or otherwise. We also saw that some others are not able to catch up with that. So we initiated a study looking at how the disparities, digital technology disparities span across the United States. So that study was published in Journal of Medical Internet Research, JMIR. We asked the question that how do health systems are looking at the digital orientations, whether such orientations can be measured, and what are the factors that influence these digital health systems orientations. We categorized all the digital technologies today in the health systems into 4 categories. One is analytics and intelligence oriented. Second one is customer oriented. Third one is growth oriented. And fourth one is futuristic or experimental digital technologies. We did find that there is substantial variation across these 4 digital orientations in health systems, which can be related to different characteristics such as size, region, ownership status, teaching status, revenue, and several other factors. Just to give an example, non-teaching health systems are focusing more on analytics and customer-oriented digital technologies compared to teaching hospitals. Similarly, we found analytic and customer-oriented digital technologies for health systems with very low uncompensated care burdens. Those of you who are from healthcare can understand that corresponds to higher revenue. And those are choosing more analytics and customer-oriented digital technologies. Similar disparities exist. So the question for us is why these disparities and what can be done to align this technology and strategy to drive what we call as the next generation digital transformation and provide competitive advantage. Where is that value creation through digital technology beyond what we know as electronic medical records, beyond those electronic medical records, which helps us to digitize and store and exchange some of this information? Beyond that, what are other areas? So our 2 panelists here have strong and very good insights into that. And that is the purpose of putting it together, to look into it with a slightly more nuanced lens. Back to Roland.
Thanks, Javon. And we appreciate the background. These raise a lot of questions. I'm curious to know, and to the people who are participating in the webinar today, if you have questions as we go along, I will be monitoring the question and answer section in the Zoom function below, so you can send them there or in the chat to me directly, and I'm happy to transfer any of those questions to our panelists. I'm curious to know, and Tanya, I'm going to start with you. Where we've seen this transformation of utilization of digital technology really just in the last 24 months. So where will we be 24 months from now, and what impact will that have on, I'm a hospital administrator. What does that mean to me as running a hospital? How will that impact me going forward?
Wow. So a lot has happened. Thank you. In 24 months. And I expect that we will.
Just so everybody knows, that celery juice, it's a little frightening.
This one is actually a different drink altogether.
Oh.
But yeah, so what we've seen in the last 24 months is kind of this unprecedented hurtling forward of utilization of digital health technologies. I think what we'll see in the next 24 months is this kind of how do we actually operationalize this truly for utilization and for use for the clinician. So, you know, I think the question, I actually just sat on a panel recently kind of talking about, you know, are digital technologies actually leaving some behind? And some would say, yes, potentially in the rural, remote, and underserved areas. So I think as hospital administrators, you're thinking about how do I serve those populations? So there's this question around how do you get that information in, if in fact you can get the people in the rural, remote, and underserved areas to use it. So that's question number one. Can you create the context in which those folks would actually use this technology? And then once you get it in, so there's kind of what we call the last mile, if you will, is what it's referred to, of getting to that last mile for rural, remote, and underserved. Let's say that we can conquer the last mile through maybe digital means. Once you get that in, and this is where I think the biggest transformation is going to happen in the next 24 months, how do you actually make that useful for the clinician? And we've talked about this before. How do you serve that up to the clinician in such a way that there is a way to make it useful so there's not so much noise? Because could you imagine this flood of remote patient technology or remote patient monitoring? Can you imagine all of the information that you could pull in from all of these digital assets? And then it serves up in the EHR as just a whole bunch of information, not necessarily insights. And so I think pulling in and making it insightful so you can separate the signal from the noise as a clinician, using all of those digital technologies, I think that's where we will see the most change and opportunity. One of the things that I think is just kind of where the rubber meets the road is digital health is excellent, and I think it can bridge a lot of gaps in care. That said, we still need in-person care. And so there is this need, I think, for this hybrid approach. I don't think digital is the panacea. I don't think it's going to solve every problem. But the question becomes, how do you leverage that digital in a clinical setting when needed to have this complementary kind of experience of information around the patient? So I think those hospital administrators who are thinking, how do we get our arms around it? I think that's the piece of it. How do you have practice transformation that pulls in this information and then makes it usable? And that brings up a whole host of interoperability issues and a whole lot of other stuff.
It brings up several questions. One of them was just sent in by one of our viewers. Does the panel think that digital health will have more impact in acute care, post-acute care, or more specialty care? And also, do you foresee patients' adoption or clinician adoption to be more difficult overall? Anybody want to address that? Is this an acute, post-acute, or specialty care issue?
I can take a stab at it. So
Okay.
I would echo some of the sentiments that Tanya mentioned. I think, first of all, Rulan, you're an administrator, and I have utmost respect for hospital system, health systems. I don't think there is a future where we will not need hospitals. We will certainly need hospitals, especially for physical body of work, for inpatient care and some surgeries. We will certainly need them. Having said that, we are sort of moving to a world of value-based care. We think that digital health companies are a stellar partners for hospitals in a value-based world. In terms of impact on acute, post-acute, and specialty, I tend to believe it will have an impact on all three. They're not separated from each other. To give an example, today 90 million Americans have one or more chronic diseases, hypertension, diabetes, dementia, arthritis. According to CDC, 75% of aggregate US health spending is on chronic conditions. In terms of public insurance, Medicare and Medicaid, 96 cents of the Medicare dollar goes towards chronic conditions, 83 cents of Medicaid dollar goes towards chronic conditions. And the care for these 90 million and growing Americans, the answer is not in-person care for two primary reasons. One, it is not scalable. And two, it has led to overutilization in the past. I tend to think that the more appropriate approach is conservative care, where you pair up advanced technology with a complement of clinical care team, and that allows care to be delivered to the patient remotely in the comfort of their homes. And certainly there have been results that show that that has led to better outcomes and is more convenient and affordable. And so in a value-based world, when digital health companies partner up with health systems, digital companies could be the first line of defense for conservative care. And for the most acute episodes of care, there are certainly hospitals that can take care of those patients and operate at their top of the license, and collectively drive a lot of value for our community. So as digital health sort of gains traction, certainly it'll have an impact on acute care, but it'll also have an impact on sort of their specialty care, where a lot of the chronic conditions are being treated in more conservative ways, and certainly on professional care as well.
Siobhan, tell us your thoughts on all this.
Yeah, all the three. Direct answer to Soumya's question in the question answer, all the three. Gradually, we are realizing that the focus of care is expanding more than just hospitals. Is upstream the river that we call it. Upstream the river issues such as community income, whether you are walking the bike or you are drinking the cereal drink or not. So all that combines our health outcomes, and that's where the shift from volume to value that is happening. So if we look at these extended possibilities, obviously not only hospital, the digital transformation not only should focus on the hospital. And this is not only in healthcare, everywhere that is happening. In other sectors also the same thing. I mean, customer orientation, curbside and at-home delivery, those kind of things we are seeing more and more. So similar kind of things has to come into digital health, into health transformation, to make it more reachable, more accessible, more viable, more catering to the upstream, more towards communities, population, and so on and so forth.
How do the people who are watching this webinar today prepare for the next 2 or 3 years? We've got people here from academics, we've got people from primary care practices, specialty care practices. What does a visionary leader do to prepare for the changes in digital disruptions over the next 24 months?
I can take it if no.
Go. We'll ask Siobhan and then Tanya and then Vikas to answer that.
We need a little bit of skill and change in mindset. Everybody who's in this panel is very important to be part of this move. You are an important piece of this puzzle. What may be missing is the way we are looking at the things. We may be working in a small hospital or working in a clinic, and we may think that digital is not for us. And then the next one, next door, another clinic that changes this paradigm and grabs our customers. That's where we'll be worried. So looking at the landscape, and probably one of the things I would strongly be proponent, come back to the schools. And we teach some of these things as we.
Well, nicely played.
Thank you.
Yeah. Tanya, I'm going to modify my question for you a bit about how do the people here prepare? Let me modify that just a bit and ask you, is it possible that the digital innovations that we're seeing, the disruptions, could actually further fragment care going forward? Is there a way in the future that it could be less patient-centric and more fragmented? What do you think?
Yeah, so I sit on a lot of these speaking panels, and it tends to be more industry focused. And I think that tells you a lot around where our focus is. We tend to think about the supply side of this rather than the demand side of this, and what's happening with what patients are asking for and wanting. And so we run the risk, and I just spoke at the health conference not long ago. And as I was walking through the halls, I thought, wow, from year 1 to year, I think it's 3 or 4 now, the boom and the explosion of all of these digital apps for health it was mind-blowing. I think it probably tripled over the course of the 2 or 3 years that conference has been going on. And I thought, how is an individual supposed to wade through this? How is even a hospital administrator or anybody putting together a health experience supposed to wade through any of this and really understand who is best? And so again, I think our focus has been so on the supply side. We've got all of these great things to offer to try to close that final mile, to try to improve health status in the home where it's much more cost effective and convenient, frankly, for the individual. But we have been pretty myopic, I think, in the industry on our side, on the supply side, rather than really digging in deep to the demand side. So I do think that there's potentially an opportunity not an opportunity, it wouldn't be a great thing, but where we end up fragmenting care more. I think we have to be mindful of this. And again, making sure that what gets in the hands of the hospital administrators and those who are delivering patient care, it's streamlined, it works within their system, it's in a value-based contract. So there is incentive to use these digital technologies and to use what I think is kind of the basis for healthcare transformation. But I think there's a ton more work to do, frankly, on the operational side and the demand side. So I think we need to be quite careful as we move forward. Can
you give me a practical example of what increased fragmentation might look like?
Oh, sure. So actually, it's one of the things that we're striving to solve for in our business at Transcarent. So today, a large employer, when I say large employer, I'll quantify that as just, let's say, 5,000 employees or above. They have anywhere from 6 to 12 what we call point solutions. So that could be a mindfulness app, that could be a centers of excellence that sits alongside their benefits plan. So now all of a sudden, where do I go? Do I go to my EAP? Do I go to this mindfulness app? Do I go to the centers of excellence? What do they do? Do I go to my health plan? Do I go to the physical therapist? Do I go to Hinge or somewhere in between? And so there's all of these awesome options. But it's almost overwhelmed at this point to be able then to actually distill down what should be used. And I think we're seeing that in Hinge is actually probably the exception because I've seen some of your studies. But what we're seeing is a very low utilization of a lot of these digital apps when employers purchase them and roll them out to their populations. It is not uncommon to see 2% of the population penetrated with the digital therapeutics, which is unfortunate. And so I think that there is a need to pay attention to the number of opportunities as they presented themselves, present them in context, Oftentimes we don't seek healthcare until we actually need it. And so being there in that moment of need and having context around that, and then again, working into clinician workflow. So yeah, that's where I see it most.
I appreciate that. And because I'm going to ask you, I'm going to even modify that question one bit further based on the answers we've got from Jiban and Tanya, that if I'm still stunned by the $826 million number, and if you've gotten that much, the apps that Tanya and Jiban talk about, there's a billion of them out there. There's some with 50 million and some with 500 million and some with 1 million. How do we differentiate? And is that good or bad? Are we creating a problem, or is the digital disruption going to lead toward better outcomes, or is it going to just confuse everybody and make us all bitter and angry?
Okay, so maybe I can take a stab at answering that question and weaving it with what Tanya said. The fragmentation, disruption, and all these terms, healthcare is not unique to it. This has happened in other industries. And I'm going to pick an example here. About 15 years ago, we used to pay whatever, hundreds of dollars for 90 or 100 channels through our cable, and we all used to hate it. It was bundled solution. And when point apps came around, Netflix, Prime, Hulu, and others, and the incumbents had a really tough time. They said this unbundling is not good for the consumer. A la carte is not going to work. And we had that play out. We've seen how that movie play out, and we're now really happy with what we have. As a matter of fact, quality of content has...
I have to tell you that your analogy, I am ashamed to admit, it brought instant clarity in my mind to the question. Thank you. Keep going. You're on a roll.
And we're all very happy with the content and how it's delivered. And this has played out in not just media, it's played out in retail, it's played out in travel. When disruption is starting, it's very uncomfortable. It feels like noise, but eventually the technology gets it right, and eventually free market system gets it right. So that's the first piece I'll say. The second piece I will say is that I think the question of fragmentation, we got to almost flip it to Tanya's point, from a consumer's, from a patient's point of view, not from our business point of view. And the way to look at it is ask from a patient's point of view, has the legacy integration really worked for the patient? And the answer is overwhelming no. So then the next question we should ask is, okay, if the integration hasn't worked, what does it take for modularity to work? And for modularity to work, what we need is a specifiable, verifiable, predictable way to at the points of interface to be able to exchange patient experience and health data. And with interoperability and FHIR standards, there is certainly a strong pathway for that. And then the third piece you got to ask is, okay, well, if integration hasn't worked and if modularity can't work, is there evidence that is modularity working? And I just shared some evidence with you around how modularity is working, whether the new fragmented component is better than the integrated component or just as good. And we have results to show that the fragmented components or modular components are actually doing a whole lot better service to our patients than legacy components. And it is not a fault of health systems. There's a lot of reasons why things have not worked. Large reasons is the way we are reimbursed in US healthcare system. But there is certainly a pathway. Nobody really knows how all of this will shake out over the next 2 to 5 years. It's too early to prognosticate, but there certainly seems that the advent of newer technologies and the change in consumer behavior portends for a path forward where we can make care affordable, improve outcomes, and make it more convenient.
We have a question that's come from one of the viewers who also happens to be on the faculty of the Health Administration Research Consortium, our good friend Wayne Cassio Jiban. And he asked a very meaningful question. So we've got all these data. that are populating the information to the practitioners and others, how do the practitioners take that data and transform it into better care? How are we providing better care to the patients? And when he asked that question, my mind went a bit forward and said, is there a correlation between the disruption that we're seeing in healthcare systems right now and, say, Uber, what Uber did to taxis? Because speaking of bitter and angry, I have spent my life being bitter and angry at how taxis treat me. And now I've got a better option. I feel like I'm better off because of that disruption. Is that, to Wayne's question, can we transform that better into what practitioners do and to direct patient care? Jabon, do you have any thoughts on this?
Yeah, the easy answer is data needs to be analyzed and insights and actions need to be drawn. The difficult answer is, sorry, not that easy. And let me go back to your taxi and Uber example. Yeah, we love that transformation, but I would occasionally like to go get a limousine, and that probably the current Uber industry is not that keen to provide me. So there is
and
this.
It's not in our budget, but I appreciate that.
So beyond the budget and from my pocket, if I want to have a really experienced consumption, good consumption experience, then high touch kicks in. So in healthcare, the touch matters a lot. And we cannot be relying only on high tech and ignore completely the high touch. So coming back to Owen's question, what are those practices which we cannot ignore and still need to maintain the touch? Which of those things can be efficiently and effectively digitized? That is what data and insight and analysis needs to provide us. Once we have that, then we know what we are going to cater to. Unlike any other industry, and our both panelists touched a little bit on that, there will be waste. There will be several fad and fashion. And that's the nature of what we call as digital evolution, dissemination, transformation in any sector, any industry you look. Maybe, but what is interesting in healthcare, earlier it used to be very sticky legacy system. At least the stickiness is changing. We are ready to change. We are welcoming the change, and that's good thing. But at the same time, the change should not be so bad that the customers lose trust from us. The customers are not empowered. So looking that side, the patient empowerment, patient trust, we need to save lives. We need to provide good care. Those things cannot be ignored, and that's the consequential nature of healthcare is important over here. So it's a cautious approach. It's a very cautious approach. Can we leave everything to market, as Vikas said? Maybe, I don't know. Should we provide some guidelines? Yes, absolutely. And that's where somewhere in the paper and in most of my talks, I say, we are missing a collaborative approach to the whole issue. Eventually, if this continues, we'll be wasting a lot more rather than following a good path of action. So the question then remains, how all of us, how all health system, how Silicon Valley entrepreneurs, how venture capitalists, everybody can come together to have this extended dialogue. How even policymakers, Washington, DC can be involved more to provide and to craft a well-articulated direction that as on today remains elusive. Whether we can craft it or not remains a big call for action. I'll pause there.
Thanks, Jabon. Tanya, Vikas, any thoughts on that?
I had a tremendous amount of thoughts on that.
Okay, bring it on.
So first I was thinking about the Uber kind of disruption paradigm. And what's interesting about that is, we pick up our phones, we have the information to be able to make our own best choice. I want the luxury vehicle, I want the sedan, I'm willing to ride with other people, I'm not, right? We have enough context to make the decisions on the ride that we want to get. It's not really that so much the case in healthcare, right? We actually have somebody who is disseminating all of that information to help us then to give us choices around care. And those are our physicians or our clinicians, right? So there is this really unique and interesting kind of complexity layer that the physicians and clinicians are expected to then absorb. And then they are the ones who then hopefully in a shared decision-making context, give us the information and context so that we can make the right decisions for ourselves. So it's a little bit of a different model. And because of that, then there is this need to say, all right, how do you then pull in all of this great information at the fingertips of the clinician? And so, and what does that look like? You know, do we need guidelines and guardrails put in by the infrastructure from the federal government, perhaps, to say, yes, this is what evidence-based medicine looks like, and that's going to pull forward into your EHR, and that we're all now managing from, you know, the best guidelines to deliver the best care. The question then becomes, how good are you at then administering that care? And so where digital technology could be really helpful on the member or consumer side is transparency into how well my doctors perform, how well, you know, they work in terms of shared decision making. So I think there's two sides to this of what is supplied then to what can digital technology supply to help better decision making for the clinician, and then what can you supply to me as the consumer to meet that clinician or decide whether or not I want to meet that clinician. But the clinician being in this translational and middle layer is different than what we see in other industries that have been transformed. So something we can't ignore. And I think that's where maybe some of the friction points come. It's also where the opportunity comes.
Yeah, I've wondered about that, Tanya. I spent a period of time as the CEO of the small hospital in Leadville, Colorado, a teeny tiny hospital at the top of a mountain. And I wonder, as we go through this and we start driving people, we provide some of these services, but then narrow down when we see practitioners. Do we narrow down the ability to see them so that we cut off places like Leadville? And are they cut out? And I don't know. I love Leadville. I love the people in Leadville. I don't want them to be cut out. Vikas, what are you thinking?
I'm glad you brought up the Leadville example. I didn't know about that, but I have consulted with facilities like that in the past. But I actually tend to believe, Roland, I'm more optimistic. I think facilities like Leadville will actually be hugely positively impacted.
Oh,
so
tell
one
me
of the
about
things,
that.
So one of the things that you asked in your question, if I'm correctly remembering, is with all of this data and information, how is the clinician able to make sense of all the things that are happening? One of the good things that will ultimately shake out from all of this ability, all of the data we're collecting and the compute power that we're seeing, is that machines will be able to render actually a pretty good clinical judgment. In fact, today, machines are able to render better imaging judgment than radiologists themselves. It's more accurate. And we should see that expand to more modalities down the road. And what that'll do is areas like Leadville, which are struggling with staffing physicians and with the right type of talent, it will allow all places like that and even other places that are more privileged with talent for their clinicians to operate at the top of their license. To Tanya's point, be able to mine the latest evidence-based clinical literature, use all of the personalized health information, and render a judgment that the clinician can then decide based on the social aspects that they are seeing in front of the patient with them, is a huge boon, especially for places like Leadville, where it might sometimes be quite difficult to find the right type of talent or encourage talent to go there. And the ability for whatever talent they have to operate at the top of the license because they're aided by intelligent machine is I think is a really positive change. It will be very uncomfortable in the interim, and incumbents will always have a tough time with change. But as we've seen over the years, it's going to be very positive for the patient and for the members.
Roland, if I might just kind of riff on that as well. And this is where potentially the government also could get involved, is to say that, so I agree, like you can democratize care very easily through the digital realm, right? You can take expertise and kind of export it to small communities, right? So people that would not have gotten excellent care may now be able to. But then there's this piece around if in fact the individual can get it, right? This is why Walmart is looking at establishing clinics in rural areas. Dollar General has done the same. It's getting that final mile where the infrastructure actually is not so great. And so actually thinking through how do we then support infrastructure bills that then get folks that connectivity, because believe it or not, connectivity is actually still an issue in some of these rural, underserved, especially remote parts of the country. And so that piece, I think that's what feels to me from where I sit in my experience, kind of a given, but that's an easy way to think about policy that then supports those rural and remote communities.
Tanya, when you say connectivity, are you talking like literally, like no
Literally. Wi-Fi, broadband, yes, reliable connectivity.
That's an issue. Jabon.
That's one issue, but once that is resolved, so the small hospital or clinic in Leadville, with substance abuse at 12 in the night, 2 a.m. in the night, would never get an access to a psychiatric. But then telemedicine kicks in and he can connect to CU Health and get the specialist who is over there. So the secondary to secondary care gets connected and just-in-time care gets available. Those are beautiful examples in my view.
You know,
Roland, can I add one comment real quick?
Yeah.
Tanya, you bring up a really good point. I think there is certainly certain areas where in rural areas, there is not enough good infrastructure. There's lack of bandwidth, Wi-Fi connection, and quite candidly, some people may not be able to afford the devices, the smartphones. So physical footprint in those instances certainly a good option. And I would add that United Healthcare recently did a study through their WellMed group, where they actually sent 200,000 of their remote underserved patients that had connectivity issues, bandwidth issues. So they sent them a device preloaded with digital content, but they had wireless connection, not Wi-Fi, wireless connection on those devices. And they actually found significant uptake and good outcomes that they're now expanding it to 94 markets. So yes, physical is an option, but again, I'm very optimistic that technology will find a way. And to your point earlier, I think all panelists have made that regulation needs to facilitate that to be able to help make and pay for some of these things.
You know, as I listen to this, I'll tell you a story that comes to my mind from Leadville, since we're talking about Leadville. I was the CEO there, as I mentioned, and one day we had a horrible accident in town. A young teenage girl had an accident in a log splitter and cut off a portion of her hand. And she came into the emergency room, and our front desk clerk, I walked down to watch this. The young girl was in the emergency room, and I watched the front desk clerk communicating with the mother. I need your insurance information, next of kin, all those kinds of things, all the business things. And she got done with that, and I watched her get done with the critical care part of that. And then she put down her pencil and she walked up around the desk and said, "Oh, Sally, I'm so sorry." And they both burst into tears. They're like neighbors. And she went through that business part, and I'm happy to say they reattached the hand, and it's a good end to the story. But as I hear this, that thought went through my mind. When can digital provide? We need that business connection. We need that personal connection. Is there a way? And for people in Leadville, European countries have kind of sacrificed this. There are no small hospitals in European countries. There's major referral centers. It's a sacrifice that European countries have made that the United States, I can't see Americans giving up on that, to be honest, but maybe so I'm going to give each of you a minute and conclusion to offer some closing thoughts on where this goes from here. So we'll go in reverse order. Jabon, then Vikas, then Tanya. Minute each.
It's complex. There will be more movements. Actually, there is a question that Ben Underhill has asked, will that lead to a bigger separation between the digital services outside the network and the providers? Maybe there is a separation. Maybe non-provider digital health kind of things will evolve more. We don't know that. We are seeing some of those yet. Some of those, but what needs to be done? Almost by all health systems managers, CEOs, need to think this is a critical hour where things are changing and they should adopt it. Otherwise, they'll be left with being the blockbusters of healthcare. We don't want that to happen.
No.
Thank you.
Vikas?
Yes. Yeah, I think that's a really good point, Roland. The way to think about this is inpatient care in some ways is failure of outpatient care. Outpatient care is failure of preventive care, home care, self-care. And self-care starts with data, education, insights, and coaching. And a company that can provide coaching to its members, Hinge Health has board-certified health coaches that are partnered with our physical therapists to actually understand the members' goals. They actually form a personal connection. They get to know the member personally and coach them through their life's journeys and their life goals. And so to your point, Roland, digital technologies are not only about apps and texts and what have you. We actually have health coaches that pair up with the member and help them walk through that journey. And we're able to do that at scale. And to me, that's a boon in some ways where companies are able to offer that solution. And it's not purely a sort of a tech solution. It is truly a centered around driving best outcomes for the member, partnering with them and having health coaches do that for them. And so the question becomes, can legacy health systems do that at scale? And we've had real trouble with that. That's part of why we're struggling. But there are solutions that actually address the social determinants aspect, the social aspect that you're talking about. One more point I'll real quickly add is that hospital systems are excellent at providing personalization at the biologic level. We at Hinge Health take that biologic personalization beyond hospitals in the facilities and take it to their homes, and then address the non-physiological factors, the social determinants of health that research has shown has a significant impact on patient satisfaction and patient outcomes. So it's a very evidence-based approach at healthcare. And again, we're very optimistic about it.
So Tanya, I'm sorry to cut in here, but we're about to get cut off. I want to thank so much the panel for this really stimulating session. Don't be the blockbuster. Tanya and Vikas, there we go. Everybody have a great day. Appreciate it.
Thank you all.
Thank you.
Thanks for tuning in, everybody. I hope you'll tune in for the next one, February 15th.
Thank you all.
Thank you.